Have you ever thought that something as simple as the way you brush your teeth could affect not just your smile, but your overall health and even lifespan? As we age, oral health becomes more than just a cosmetic concern. According to the National Institute on Aging, more than 60% of adults over 65 experience some form of gum disease, and poor oral hygiene is strongly linked to heart disease, diabetes, and even stroke. That's why in this video, we'll break down each of the 3 most common brushing mistakes that seniors make, explain the science behind why they are harmful, and provide simple, practical steps you can take immediately to protect your oral and overall health. But before we jump in, don't forget to hit the like button and subscribe to Golden Aging Health, where we share expert-backed strategies to help seniors stay strong, energized, and healthy. Now, I'll reveal the first mistake that many seniors don't even realize they're making, and how correcting it can dramatically reduce your risk of inflammation and heart problems.
Brushing mistake number 1. Brushing too hard. Many seniors think that applying more force when brushing will remove more plaque. But here's the surprising truth. Brushing too hard can damage your gums and teeth, increasing your risk of serious health issues. Meet Mary, a 68-year-old retired teacher who had always been diligent about her oral hygiene. She believed that the harder she brushed, the cleaner her teeth would be, and that plaque or tartar would never stand a chance. For years, she brushed vigorously twice a day, often scrubbing in a back-and-forth motion and applying significant pressure, thinking it showed good discipline. At first, she noticed nothing unusual, but over time, subtle signs began to appear. Her gums started to recede, exposing more of her tooth roots, and she experienced increasing sensitivity to hot and cold foods. Mary initially dismissed these symptoms as normal aging, but during a routine dental visit, her dentist discovered early-stage gum disease and noticeable enamel erosion. The enamel, which acts as a protective shield for teeth, had been worn down by the constant abrasive brushing, leaving the dentin exposed. This damage didn't just affect her comfort and chewing ability, but it also created pockets between her teeth and gums where harmful bacteria could accumulate. Over weeks and months, these bacteria produced toxins that irritated her gums and gradually entered her bloodstream, triggering low-level chronic inflammation throughout her body. This inflammation is not merely a dental problem. According to Harvard Health, chronic oral inflammation is linked to a host of systemic health issues in older adults. It can increase the risk of heart disease, as bacterial toxins can accelerate plaque formation in arteries. Stroke risk may also rise due to the same inflammatory pathways. For seniors managing type 2 diabetes, gum disease can make blood sugar harder to control, creating a vicious cycle where poor oral health worsens metabolic health and vice versa. Mary's experience is a clear example of how a seemingly simple habit, when done incorrectly, can quietly impact overall longevity and quality of life. So, how can you protect your teeth and gums without sacrificing cleanliness? Here are some practical tips. Use a soft bristle toothbrush. Soft bristles are gentler on your gums and enamel, reducing the risk of damage. Electric toothbrushes with pressure sensors are also excellent for seniors, as they alert you when you are brushing too hard. Gentle circular motions. Instead of scrubbing back and forth, move your brush in small circles across all surfaces of your teeth. This technique effectively removes plaque while protecting your gums. Timing matters. Brush for at least 2 minutes twice a day.
Focus on quality over force. Many seniors find a timer helpful to ensure consistent brushing without overdoing it. Check for gum health. If your gums bleed or feel sore, this is a sign you may be brushing too hard or have underlying gum disease. Don't ignore these signs. Schedule a dental visit promptly. Ever noticed your gums receding or bleeding when brushing? Share your experience in the comments below. Let's help each other catch these silent problems early.
Brushing mistake number 2. Skipping flossing and its hidden dangers. For many seniors, flossing seems optional, but it's a critical part of oral health. According to the American Heart Association, flossing removes plaque and food particles from areas your toothbrush cannot reach, especially between teeth and near the gum line. Without it, plaque hardens into tartar, which can only be removed professionally. Over time, this can lead to gingivitis, periodontitis, and tooth loss. Mayo Clinic studies also highlight that chronic gum inflammation from poor flossing is linked to higher risks of heart disease, diabetes complications, and even cognitive decline in older adults. So, how should seniors incorporate flossing into their routine? Start gently. Use a standard dental floss or a water flosser, especially if manual dexterity is limited. Aim to floss once daily, preferably before bedtime, to remove the day's accumulated plaque. Gently slide the floss between each tooth and curve it around the base, making sure you go just beneath the gum line without forcing it. This prevents bleeding while effectively clearing debris. If traditional flossing is challenging due to arthritis or hand tremors, consider pre-threaded flossers or soft picks. Water flossers have also been shown to reduce gum inflammation by up to 60% in seniors with mild to moderate periodontitis, according to research published in the Journal of Clinical Periodontology, 2022. Another key point: don't skip flossing even if your teeth feel clean. Plaque is invisible and can silently damage gums over time. Early signs to watch for include bleeding when flossing, bad breath, and swollen gums. Detecting these warning signs early and improving your flossing routine can save your teeth and your health.
Brushing mistake number 3, using the wrong toothpaste or ignoring fluoride. Let's talk about Susan, a 68-year-old retired teacher who loved taking care of her health. She exercised regularly, ate a balanced diet, and read up on wellness tips almost every day. A few years ago, Susan decided to switch to a natural toothpaste free of fluoride, thinking it would be gentler on her teeth and safer for long-term use. At first, everything seemed fine. Her mouth felt fresh and she liked the taste. But about 6 months in, she began to notice something strange. Her teeth were starting to feel unusually sensitive to hot and cold foods, something she had never experienced before. By the time a year had passed, she could see white spots appearing on her molars, small areas that looked slightly chalky compared to the rest of her enamel. Soon after, she even found tiny cavities forming between her teeth, especially in spots where brushing was slightly more difficult. Susan had always believed that as long as she brushed daily, her teeth would remain healthy. So she was shocked. She assumed she was doing everything right, yet her oral health was declining quietly and steadily. During her dental visit, her dentist explained the issue. Without fluoride, her enamel had lost some of its natural protection against acids produced by bacteria in the mouth. Even though she brushed regularly, her teeth were no longer as resistant to decay. The dentist highlighted that for seniors, enamel naturally thins with age, gums may recede, and roots become more exposed, making fluoride a critical line of defense against cavities. In Susan's case, switching to a non-fluoride toothpaste removed that protection, allowing decay to take hold more easily. This story isn't uncommon. Many seniors, especially those over 60, are drawn to all-natural or chemical-free products, thinking they're healthier. While the intention is good, skipping fluoride can have serious consequences over time, including increased sensitivity, higher risk of cavities, and even tooth loss. The dentist emphasized that it's not just about brushing. What you use while brushing matters as much as how often you brush. It's also important to avoid overly abrasive toothpastes. Seniors with sensitive teeth, gum recession, or dental restorations should choose a low abrasion toothpaste to prevent enamel wear. Products labeled as for sensitive teeth or containing potassium nitrate can reduce discomfort while still providing fluoride protection. A 2021 study published in the Journal of the American Dental Association found that seniors who brushed with fluoride toothpaste twice daily experienced a 25% reduction in new cavities over 2 years compared to those using non-fluoride alternatives. Additionally, Mayo Clinic emphasizes that fluoride use contributes to better long-term oral health, potentially reducing the need for invasive dental procedures later in life.
Practical steps for seniors. Brush twice daily with a pea-sized amount of fluoride toothpaste, ideally after breakfast and before bed. Use a soft bristled toothbrush, gently brushing in small circular motions to minimize gum irritation. If swallowing toothpaste is a concern, use a fluoride rinse as an alternative, but it should not replace brushing. Another key insight: combining fluoride toothpaste with regular dental checkups amplifies benefits. Dentists can detect early decay and provide supplemental fluoride treatments or protective sealants, which are especially effective for older adults.
Ignoring this step may lead to tooth loss, infections, and even complications in systemic conditions like diabetes or heart disease. Switching toothpaste can sometimes lead to noticeable changes in your teeth or gums. Share your experience in the comments. Your story could help others make smarter choices for their oral health.
Let's take a moment to recap the 3 crucial brushing habits that seniors over 60 should focus on to protect their teeth and overall health. Brushing too hard, skipping flossing, using the wrong toothpaste. It's not about completely overhauling your routine overnight. Small, consistent changes make the biggest difference, especially after 60. By brushing gently with the right tools and flossing daily, you're not only protecting your teeth and gums, but also supporting heart health, reducing inflammation, and maintaining stable blood sugar levels. If this video helped, please like, share, and subscribe to Golden Aging Health for more science-backed tips to keep you strong, mobile, and thriving well into your golden years. Thanks for watching, and see you next time.